Have you ever had to be admitted or visit someone in the hospital? You hear most people say, I hate the hospital. This is understanding considering germs, illnesses, and usually emotional times. Having a career as a intensive care unit nurse, you are willing to endure these things every day. A decent part of the population spends their first hour of work drinking coffee or checking Facebook. As an ICU nurse, you are probably covered in another human's bodily fluids by the first hour. As stated in becoming a critical care nurse, you need to earn a bachelor's in science as a new graduate. You might first need to work on a regular floor to gain a few years of experience. This will help you get down your skills and feel more comfortable. Once you get a job in the ICU, you will feel comfortable with your skills. On an ICU floor, new nurses receive prolonged orientation periods compared to other floors due to critical care information. As an ICU nurse, you will most likely work in a larger hospital that has medical and intensive care units. American Association of Critical Care Nurses states in an ICU setting, the nurse-to-patient ratio is 1:1 because it's such intensive care. On most floors, you usually have maybe 6 to 10 patients. As stated in the New York Post, people who are at the end of their lives or being kept alive artificially have a way of shutting down. ICU patients have urinary catheters and IVs, often larger IVs placed centrally towards their heart. The patients also have breathing tubes, feeding tubes, and rectal tubes. As an ICU nurse, you care for the patients who are fighting to die. Unfortunately, on an ICU floor, you will either die with permission or a code blue. As being a nurse isn't emotionally draining enough, according to Health Affairs, you are working 12-hour shifts. Shifts are either from 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. Nursing is also physically challenging. Proper body mechanics are also essential in nursing. A lot of nurses throw out their back and really can't work, sometimes after the age of like 40, 50. Even when you think you can't make it through your shift and your back is killing you, no one prepares you for watching lives be permanently altered. In the article, I wish I could cry with you, but I can't. An ICU nurse says, it never gets easier to do this. You just get used to it. You figure out how to do it. Your already long day begins at 6:30 a.m. or p.m. to receive a report from the previous nurse. Once you receive a report, you ask any other important questions that you might have for the patient for the day. You begin your day with starting with vital signs. This is very important. Vital signs include heart rate and rhythms monitored by EKGs, blood pressure, temperature, respiration rates, and oxygen in your blood by a finger probe. After vital signs, you begin assessing the patient. Assessments include checking the pulse, all the pulses everywhere, breath volumes, chest sounds, pupil sizes and shapes, levels of consciousness, and a pain experienced by the patient on a level 1 to 10. Also on an ICU floor, all fluids for input and output are measured. This is for people with surgeries. They have to measure how much they're drinking and then how much they're putting out so they know everything and the kidneys are proper and functional. They check the skin integrity and dressings and drains. This is all done every hour for any change could be critical. The nurse also assists with daily care for the patient as bed baths, brushing teeth, changing linens. Their nurses also have to constantly check their orders for lab work. Drawing labs on ICU floors is very important. Blood work will show any sudden change so the doctors can adjust patients' orderly and care plan. The rest of the day involves following treatment plans and administering medication. In addition to dealing with the care needs of patients and usually distressed family members. You have to stock the rooms, make sure everything's okay, help other nurses, admit the new patients. The sounds of screaming and incapacitated patients are also followed by medical alarms and IV pumps. Just the first hour of your 12-hour shift can seem hectic and overwhelming, but you have to stay focused mentally. You need to stay focused and be prepared literally for anything. Critical care thinking can save a life. During the day, you will try to find time to chart just to be interrupted by a call or alarm. Charting is very important. This keeps track of anything that happens with the patient. This includes altered mental status and even your last bowel movement. For some, a career in nursing is not their cup of tea. Also, thousands of men and women around the world find nursing exciting and rewarding. Thank you.